Good afternoon, everyone. Welcome to the, whoops, channel 3 fell over. We thank you all for coming and welcome you to the Cannstatter Verein here on Academy Road in Northeast Philadelphia. It's a pleasure to be able to serve the city in the way that we can with our wonderful large facilities that lend themselves well to a mass vaccination. It's very important here in Northeast Philly that we get the people vaccinated, and in fact, this is the first such site in Northeast Philadelphia. So we want to thank the city for your contributions and for your partnership, and I'd like to turn it over. Thanks.
Thank you. Well, guten Nachmittag. Good afternoon, everyone. First, I want to thank the Health Department, the Fire Department, OEM, members of the Cannstatter Volksfest Verein German-American Club, and Councilmember Henon for helping make today happen. I'm excited to be here for the first city-run vaccine clinic in the Northeast, which is the city's 7th community mass vaccination site. I know how important it is to make vaccines available in every neighborhood, and today is even more evidence that we are accomplishing that goal. As exciting as it is to see 6,000 people per day get vaccinated at the FEMA clinic, I know that people like to stay in their neighborhoods and get vaccines close to where they live. So thanks to the folks at Cannstatter, we're making that happen here in Northeast Philly. We're continuing to open new clinics throughout the city, and the health department keeps adding new vaccine partners to our list. Dr. Farley said yesterday that there are now more than 200 sites in Philadelphia giving vaccines. I announced yesterday that I recently got my first dose of COVID vaccine, and I couldn't be more excited about it. I was one of the more than 100,000 people in Philadelphia last week that got the shot. I know it hasn't always been smooth. I know that a lot of people are still waiting for their shot, but we are vaccinating more people than ever, which means that soon we will be able to start to move to phase 1C, then phase 2, and start to get things back to new normal and better than normal. But last but not least, we urge residents who want to get vaccinated to schedule their appointments at phila.gov /vaccine interest. That's phila.gov /vaccine interest, or call 311 and they will sign up for you. Now I'm going to turn it over to Dr. Farley for more details about today's operation. Thank you.
Thank you very much, Mayor. Before we talk about vaccination, I do just want to remind people that case rates for COVID infection in Philadelphia right now are rising. Hospitalizations are rising. The risk is greater now than it has been for the past couple of months. This epidemic is not over. The virus is still here. The virus is still deadly. What can we do in the short term? Wear a mask, keep a distance. What we can do over the longer term is get people vaccinated, which is why we're here today. Most of you have been at a number of these conferences we've had. As you know, we're offering vaccination through many different channels across the city. There are hospitals, there are federally qualified health centers and other clinics, and there are an increasing number of pharmacies, and particularly in the Northeast. There are many pharmacies now that have just come on board, particularly recently. And we have community providers like the Black Doctors COVID Consortium, and then we have the very large Center City Vaccination Center at the Convention Center. But it is clear in discussions we've had with community members that some people will not go to the Convention Center. Some people want to be able to have it close to home. And so as an assurance, the city is operating these clinics across the city, so that every neighborhood has at least one city-operated vaccination center. We have been, so far, in North Philadelphia, Juniata Park, and West Philadelphia. Last week, we expanded to South Philadelphia. And this week, with the help of the Fire Department and the Office of Emergency Management, we're expanding here to the Northeast and the Northwest. So I want to first, I hope you noticed that the people working out here are employees of the Fire Department and the Office of Emergency Management. I really want to thank that agency for stepping up. There's been a number of clinics that they have run, and I've heard nothing but rave reviews from people about how all those clinics have operated. It's really been great. The people who are being vaccinated here today are people who are in our vaccine interest database, same database that the mayor just talked about, who have been invited, or some have been referred by community organizations. Now, for some of our clinics like these, if there are open slots, we have opened them up to walk-ins. However, these are popular, so not all of them have open slots. This is one that does not have open slots. All of our slots are filled. I'm told that we expect to vaccinate 525 people here today. from 1 p.m. until, I believe it's 9 p.m. This clinic will be using Johnson & Johnson vaccine. Okay, so this is in a single dose. So these people will be finished with their vaccination when they walk out here today. It's going to be easier for people themselves. It's also easier for us in operating the clinic because we don't need to take the time to schedule people for the second dose. We will be returning to the Northeast, to this region, to continue to do clinics as long as it is necessary. The sites may change, but we're going to be in this neighborhood as long as it is needed. The City of Philadelphia has 1.2 million adults. It has 1.6 million people overall. It's a long time to vaccinate that many people, but each step takes us one step closer. Thanks very much, and I want to turn it over now to Adam Teal, Commissioner for the Fire Department and Office of Emergency Management.
Thank you, Dr. Farley, and thanks to all of the great partners and, of course, the leadership that you see here. I have been working side by side with these folks and certainly have seen the mayor's leadership consistently over the past now more than a year. And the Fire Department and Office of Emergency Management have been very proud to support our partners in public health and many other agencies with the ongoing fight against COVID-19. Over the past several weeks, we've been thrilled to be out in the front lines, as we always are, 24/7, 365, actually delivering vaccinations to city residents. Whether in a church in North Philly or West Philly, we're supporting the Black Doctors COVID Consortium right now at the Leocoris Center. And of course, we're really excited, as you can see, the dedicated women and men of the Philadelphia Fire Department here in the Northeast. We'll be opening another site at 55th and Market this week, and also at 78th and Ogons later on this week. So we're absolutely it's a little bit emotional for me actually to be able to see the impact that our folks are having on people who need this critical vaccine. As Dr. Farley is fond of saying, we might be done with the virus, but the virus is not done with us. And I can tell you that we in the Fire Department, Office of Emergency Management, as we always do, we are fighting back and helping our neighbors and every neighborhood across the city combat this deadly virus. So thank you all for being here, and most of all, thanks to the dedicated women and men, almost 3,000 strong, of the Philadelphia Fire Department and Office of Emergency Management for adding this to our mission, 800 to 1,000 times a day, responding to emergencies of all types. For us, it's really great to be able to proactively help combat this deadly virus. Thank you, and Councilman.
Thank you, Commissioner, and I am so excited for being here today to celebrate the opening of the city's first health department run clinic for vaccine inoculations here in Northeast Philadelphia. So welcome to Northeast, and that wouldn't have been possible without Mayor Kenney. Mayor Kenney, I want to thank you for doing such a good job under very strenuous circumstances, the passion, the people being afraid of the vaccine, people being afraid of getting sick. I know early on in the virus, people were saying, well, what do you want to be scared of? Scared of the vaccine or scared of getting COVID and going to the hospital and not being able to see your loved ones? So we are at that point. And I want to thank Dr. Farley, who is on the front lines, answering all these questions, as he will be today, and the health department, who are out here trying to execute a plan for the entire city to be inoculated, trying to execute a plan that's structured where it could be in every neighborhood. Some neighborhoods, it took a little bit longer, but Northeast Philly welcomes it. Commissioner Teal, thank you for allowing your men and women of our great fire department to look after our residents and making sure that they can feel safe getting the vaccine. And it is very exciting. Dr. Farley is talking about pharmacies that have stepped up in Northeast Philadelphia, and they have. So one of the plans with the health department inoculating, getting shots in arms, is utilizing these pharmacies, whether it's a Rite Aid or it's private pharmacies. And they've been doing a good job. While they don't have press conference about those pharmacies, they've been putting shots in arms for some time, and there's a couple of them who have filled that gap that I want to thank. Deluxe Pharmacy, Rappaport Pharmacy, and Savon time with Acme Pharmacy, who has been a real champion in trying to make sure that their services are available and making sure that we get to the herd immunity that is so desperately needed. And I think the message here today is that the process is going to move quickly at this point. More doses are going to be available, and I know people have been waiting for a long time, but now is the time to start talking to your friends and your family and your neighbors of the importance of being vaccinated and making sure that you get inoculated so we can get to that safe place where we can all be reunited with our family, reopen our economy. So being a vaccine ambassador, which I'm asking the general public, especially up here in Northeast Philadelphia, be that ambassador. Encourage your family and your friends and your neighbors who are sitting on the fence whether they should get the vaccine or not. All right? Everybody will have the opportunity to get vaccine. All right? Now's the time to set an appointment. You know, my mother, all right, who has been sheltered in her house for a little over a year, just received her second shot today. She is so excited in 2 weeks to go out to dinner with somebody who else was vaccinated so they can enjoy some sort of normalcy. All right, that's what we encourage all our friends and families and neighbors to do. Sign up. Make sure that you fill out the vaccine interest form with the health department. Call my office, all right, and trust, all right, that the health department and the mayor of the city of Philadelphia, all right, knows how to vaccinate people and knows what's in the best interest of Philadelphia so we can reopen and reunite with our family and have our economy set in a positive direction so we can get back to normal. So, I'm excited to be here. I want to thank Cannstatters, Pete and Pauline, who do a great job of offering their hospitality here for Northeast residents. So thank you all. Have a safe and happy day.
Thank you all. Questions from the press?
Dr. Farley, I have a question for you.
How did you get to go to Cannstatters? I mean, it's a private consortium, private business in the Northeast. How did that happen?
We work very closely together, the health department and managing director's office, OEM, fire department, to identify locations that are objectively within areas where we need to get vaccination. So it's a little bit of a complicated process, looking at vaccine rates, looking at testing rates, obviously looking at the geography. Logistics are a big part of it. So we really are looking for places that have large areas where we can have the proper social distancing between the vaccination stations in the waiting area. So there are a lot of logistical concerns that go into this. This is what we do 24/7, 365, every day, almost all day. We talk about sites, and we're constantly looking for sites and evaluating sites to achieve our goal, as you heard the mayor and Dr. Farley say, of ensuring that we have this vaccine available in every neighborhood of the city as we get more vaccine into the city. So we're constantly evaluating sites. We're doing pop-ups. We're doing mobile things. We're going to be doing homebound vaccination. So this is still a very dynamic situation, but we're happy here geographically. This is an area where we needed to get the vaccine along with the other clinics that we're launching this week.
But how did you get to Cannstatters? I'm saying, did they call you or did you call them? Who reached out to who?
This is not a private business. It's a nonprofit. Okay. It's a well-known, iconic institution in Northeast Philadelphia. It's in a location everybody knows. Everybody's been here at one time or another, whether you're German or not. You've been through this building, and it's located it has parking. It's located in a place that's a well-known intersection, well-traveled intersection, and they were gracious enough to help us do it. We just opened one up in the Edward O'Malley Athletic Association in South Philly this week, which is where I grew up and where I played ball. So they were gracious enough to open up their facility, as Cannstatters is gracious enough to open up theirs.
And I actually now have a question for Commissioner Teal too. When you're talking about the pop-up and also the homebound sites, I know you talked about it a little bit before, but can you give us an idea of a timeline for all that?
I really can't. There are so many factors that play into this. One of the things that we track every day is vaccine availability. And as the doctor will tell you, that literally changes on a day-to-day basis. So we have plans. We're constantly planning. A lot of great folks in OEM where that's all they do is plan with our health department partners. So for us, we're constantly having to pivot and consider all of these different factors that go into it. But we're really excited to get out there and start that homebound mission. We know there are other community partners that are doing that. That's obviously something that we do 800 to 1,000 times a day already in the fire department, so this really makes sense. Figuring out how to do it, though, is complicated. There's no one list, so we're getting a lot of information from a lot of different streams. We have to look at that against vaccine availability, which is constantly kind of up and down, plus balancing all of the other missions that we have and all of the other sites. So it's a great point. We really want folks, please keep checking the health department's COVID page. Please really read and look at the guidance to make sure we do have places where you can walk up without an appointment. Most of the sites, you do have to have an appointment. So this is going to be a kind of a moving target for a while yet, as everybody sees, even nationally. And I'm just, honestly so happy to have such a great set of partners to be able to do this, because it's not something any of us could do alone.
Dr. Farley, I got a multiple tier question. And you may have addressed it, I got here at the tail end of your statement. Can you answer, one, where we are as far as the transmission rate in Philadelphia? Two, how this is going to help you lower those, or at least help plan your attack on lowering those rates, because Philadelphia yesterday announced it's going to follow its own kind of guidances on reopening. Right. Can you comment on those kinds of things?
Yeah, so case rates for COVID infection right now in Philadelphia are rising. We're more than 400 cases per day as of the press conference we had last week. And the people hospitalized with this infection, that number is also rising. We know that deaths tend to lag behind that, and so I would expect that we're going to have increased deaths from COVID. I hate to say that, but I can expect that based on the numbers we're seeing right now. So this is a very dangerous period. We have not yet vaccinated enough people to stop this particular wave of the epidemic, which is why it's so important for people to continue to wear their masks, keep their distance, stay away from other people, because most other people still, likewise, are not vaccinated. I don't have exact numbers on the top of my head. I can tell you that somewhere around 40% of people over the age of 75 are vaccinated. Somewhere around 30% of people, 65 to 74, are vaccinated. And overall, we may be around 20% of adults in the city vaccinated. That's good. A lot of those people are protected, but that means the majority of people are still not protected. So we're not going to have enough coverage to protect people from this wave. In a month, we'll be in a much better place, but not right now.
Do you have an idea of maybe why this is happening, the increase in cases? Are people traveling more, coming back, and just not following the guidance?
It's not clear. It is clear if you look at the map of the country. The hottest spot in the country right now is New Jersey, so not far away from us, and we're seeing increases in lots of parts of the country. It could be just due to variants of this virus, which are more easily spread. It could be that everybody's just gotten tired of this and they've let down their guard. Or there are other things we never understand about why the epidemic waxes and wanes. It just be that we're due for this. The message is still the same, though, that the risk is out there and it's increasing. We have to be very careful now.
As far as the number of people vaccinated, are you happy with that number so far?
No, I'm not going to be happy until we have the entire city protected.
And Dr. Farley, specifically at the neighborhood sites, when we were at the O'Malley one and other ones, people seemed really receptive to it, and it seemed like there were a lot of people. Right. Is it hitting the mark that you had anticipated with the amount of people you're getting at the smaller sites?
Definitely, there's a lot of interest in these community sites. We want to do as many as we can. There's a lot of interest everywhere. Right now, their demand for this vaccine is greater than the supply we have. I hope the demand stays high for as long as we get everyone vaccinated. But and it's clear from all these neighborhood sites that there are people who would not go down to the convention center. We absolutely need to have these services available throughout the city. They are available throughout the city through many different providers, but for an assurance, have the city run some, make sure that everybody has at least one that's nearby them.
And I don't have the exact quote, but I think President Biden had said that there may be actually more vaccines available, I believe was the gist of what he was saying, in the coming weeks than had previously anticipated. Is that what you're hearing? Is that will that change anything?
We've heard announcements from the White House about more vaccine coming. but we've not heard anything concrete that says here's how many doses Philadelphia is going to get in the next 2 weeks, 4 weeks, or 6 weeks. So we're still planning with a lot of uncertainty. I am excited to hear these national announcements. I hope the vaccine arrives, and our job is to expand our vaccination capacity to meet that for when the vaccine does arrive.
And you mentioned the people that are getting vaccinated here are people who registered through the city's portal or website.
Right.
Is it just people who live in this area, or could it be people from outside of the area that's coming here?
People could be from anywhere here. We've had sort of preferentially invited people in the immediate area, but anybody from the city could register on that site. Anybody in the city could be scheduled for an appointment here.
What are the hours that this site is going to be operational?
It's 1 p.m. to, and I've already forgotten, I believe it's 9 p.m.
Is that Monday, 7 days a week, or?
Right now, we're just here today, and then we'll be back in the Northeast next week. But the exact location and the schedule for next week is yet to be set.
So this site is only for today, then, correct?
Right now, this is for today.
Okay.
And, Mayor, this morning you had a press conference talking about reopening the city.
Yep.
How much of an impact are the smaller sites going to have on the overall vaccination, do you think, that would put us in line to, I don't want to say speed up, but at least be on the track that you guys are anticipating?
Well, I think it's two things. I think it's the number of sites in the neighborhoods, and I think it's also J&J with the single shot that's going to really put us a little bit into warp speed as opposed to having 2 shots. And I really do believe that, I think this is a J&J?
Yes.
I mean, so these folks won't have to come back. And it'll speed up that process. And the more and more folks get vaccinated, the more and more folks feel safe, the more they're likely to go out to retail, restaurants, spend money, do those things, go back to work in an office building. It's just a matter of getting everybody to that place where, 70% of the folks, we're hoping 70% of the people in the city and the country are vaccinated ultimately, and then we start having that herd issue.
If I could just add one thing on that. I mean, these clinics that the city is running will probably vaccinate a pretty small fraction of the total people vaccinated in the city. The biggest providers tend to be hospitals, and then pharmacies a close second. We're small, but if you look at these clinics, these are very vulnerable people. These are important people to vaccinate to save their lives. So even maybe small in number, it's a crucial part of the overall picture.
Councilman Henon, I know this question someone has been asked, but you said people can call your office. The mayor gave Philadelphia/vaccinated and 311, but for people in the Northeast, whether they're Longcrest, Frankfurt, Somerton, Barkwood, what would you tell them to do who haven't been vaccinated yet?
Well, I would encourage them first and foremost, right? I know there's, several kind of lists, and there might not be a central portal. You have to register with the City of Philadelphia's health department in its COVID interest form. I think that is critical. With that, you can certainly call my office where we can, push your information out once you expressed interest in receiving the vaccine to other local pharmacies. They, encourage, wherever you live to call your local pharmacies, try to get on their list, express interest, let them know that your first step was signing up an interest form with the city's health department. And that includes 311 for those. I have found out that a lot of seniors don't use email. So that's why 311 was in the plan back in November as far as the city's Philadelphia vaccination plan that was introduced to the national CDC. So 311 for those who do not have email and electronic access to the city's health department or online services. And if you are connected, make sure you express interest and fill out the form with the city's health department.
And your office number is on
Tarzo Ave, 215-686-3444. That would be your second call.
Any more questions? Thank you. Thank you all very much.